I am Dr. Sudheer Tyagi. I am a senior consultant neurosurgeon at Apollo Hospital, New Delhi. I am working in Apollo Hospital, New Delhi for last 21 years, and the kind of surgery I am doing, including all kind of the brain tumor surgery, neurovascular surgery, and the functional osteotactic neurosurgery. Other than this, we do minimal invasive spine surgery and spinal instrumentations. As far as deep brain stimulation surgery is concerned, which is usually called DBS, this is the therapy which has come for the patients of Parkinson's disease, like patients who are having movement disorder, and they are not the patients who are not controlled on the medical treatment. Initially, these patients are treated by the physician, then by the neurophysician, and when these patients come to us, we have to evaluate them whether the patient is really need surgery or doesn't need surgery. So they have to at least complete last more than few years of the medical treatment, and the neurophysician should decide whether the medical treatment is working or not working. If the neurophysician thinks that the medical treatment is not working or there are a lot of side effects of the medical treatment are coming, then only these patients are taken up for the surgical treatment. Other than Parkinson's disease, we are doing deep brain stimulation surgery in patients with intractable epilepsy, where the multiple foci are there, and the patient with OCD, like obsessive compulsive disorders, and patient with dystonias. So these are the patients which we are treating with deep brain stimulation surgery. Initially, deep brain stimulation surgery was kind of very difficult because the localization of this deep part of the brain was very difficult, and people used to do with the ventriculography, putting the dye inside the brain and then calculating the nucleus from the midline of the structures of the brain. But now I am using the image fusion technique, in which the CT scan images and the MRI images are taken, and they are fused on the computer, and from that we can calculate easily and with more precision where the exact nucleus, that group of neurons which we want to stimulate, is actually situated. So these patients can be treated more safely with this technique and more precisely and with a greater accuracy. The patient which we have treated with the deep brain stimulation has come to us from the different part of the world, not only from India, and they have tried the treatment at the various countries and with the various doctors, and when they are not been able to get corrected their symptoms, then these patients has come to us, and then I have operated this patient with the deep brain stimulation. The best thing with the deep brain stimulation is that it doesn't destroy any part of the brain. It basically stimulates this particular group of neurons. So if any part is not damaged, that part can be used for other therapies also in future, like genetic treatments and all kind of therapy which we are coming up in the future. So if we are not damaging any part of the brain, just stimulating that group of neurons, that the neurons are totally intact. So this is deep brain stimulation.